Ladies and gentlemen, I am pleased to present this e-poster under the title of Cerebral Hydatid Cyst about a multi-recurrence case. Intracranial localization is a very rare site for hydatid cysts, as it represents only 2% of all the intracranial lesions, even in the countries where the disease is endemic. The prognosis for this condition is generally favorable, but it may be worsened in case of recurrence. We report the case of a 16-year-old boy who presented with an intracranial hypertension syndrome and right hemiparesis. A brain CT scan was performed and showed, as you can see in figure number 1, a left frontoparietal hypodense well-limited lesion without any enhancement, which was suggestive of hydatid cyst. The patient underwent surgery and the perioperative occurred of a rupture of the cyst. An irrigation of the cavity with hypotonic solution was performed, and the patient received 2 months of antiemetics. 7 months later, the child presented with the same initial symptomatology. Another CT scan was performed and showed, as you can see in figure number 2, this time 6 cysts in the left hemisphere. The patient underwent surgery for the second time, and perioperative course was uneventful. 22 months later, the patient presents with right hemiplegia and altered neurological state 2. Brain CT scan, as you can see in figure number 3, 4, and 5, showed this time 13 cysts, 6 in the right hemisphere and 7 in the left hemisphere. The patient had an emergent surgery for evacuation of the cyst in the left side, and another surgery is to be scheduled later to resecate the remaining cyst. In fact, it is interesting to know that an intracranial hydatid cyst is relatively a rare entity. They are most commonly seen in children and young adults. Their rarity, coupled to non-specific symptoms, need a high degree of clinical suspicion and thus present a diagnostic difficulty. The characteristic scanographic aspect is a well-limited spheroid or ovoid hypodense non-enhancing cystic lesion with no pericystic edema, which is sufficient for the diagnostic. Surgical resection remains the best therapeutic option. The aim of the surgery is to evacuate the cyst totally without rupture, as the spillage of the scoliosis may lead to anaphylaxis and the recurrence of the disease. Because, as we know, surgical resection in case of recurrence may be more difficult, because it can force to a multitask surgical care. To conclude, hydatid disease causes considerable morbidity in our region and other endemic areas. Besides surgery and the prescription of drugs, prevention is equally important, for which a goal-directed public health policy has to be performed. Thank you for your attention.